Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you, so thanks for hanging on afterwards.
Oh, that's great.
A 61-year-old man, his football game got spiked. The spot is still sore. He's wondering if it could develop into cancer. So he's 61, and he was spiked when he was in high school, and it's still sore. Take-home message?
Probably won't cause cancer.
No.
So it's just sore. It's a
Sore,
ligament.
it's probably an old injury, ligamentous injury. Yeah.
Unless it starts swelling.
Yep.
Husband passed away from supposed squamous cell cancer. It started in the penis, developed further in pancake-like shape, and eventually traveled to his brain, causing blindness. Comment on the progression of this cancer. So squamous cell cancer can occur on any part of the skin. Penis is irritated there on the foreskin, but any squamous cell cancer of the skin can metastasize to the brain. What do you do in those cases?
Same as for the other tumors. It's for the squamous cell type of tumor, it's much less common for it to spread the way that the other cancers do, the adenocarcinomas and so on, which is through the lymphatics of the bloodstream. Most commonly what we see with that is they directly spread from somewhere, start somewhere on the head and spread directly into the skull.
But you deal with skin cancer or squamous cell cancers from the mouth that spread to lymphs and so on.
Yeah, brain isn't the most common. He's exactly right. The only way it can spread is sometimes going back along the nerves that then track up and follow. It's kind of like following the road back to the brain. But most of the time it'll spread to the lymph node. The lung is by far the most
The
common.
squamous cell lung.
It would surprise me even with this one that it didn't spread to the lung and then brain. It can, but it's rare.
So how many of your cancers of the head and neck are squamous cell from mouth or skin?
Oh, about probably 80%.
Really?
Yep.
And they go lymph node in the neck?
It's kind of like an army. There's a base, and then there's the first post, second post, and it keeps spreading down.
All right. 59-year-old from Pierre, caller has lumps in the lower jaw behind bottom teeth for over 15 years, fairly large. What might they be? Lumps behind the teeth.
They're benign, little bony growths.
Yep.
And they happen with age. There's a specific name for them. I won't say it, but they're completely benign. The only thing they make it is a little hard to fit dentures on.
Yeah. What about torus pallidus?
That's exactly. It's either tori mandibuli or torus pallidus. It's the same thing except for growing the hard part of your palate.
And people have these big, huge lumps that look dangerous on the top of their mouth, and they've been there for years. Totally benign.
Yep.
60-year-old Westington, what are the signs and symptoms of a brain aneurysm, Hank?
Unfortunately, not enough. Most of the time that the brain aneurysm is discovered is when it ruptures, which then it causes severe headache and coma, and that's a very dangerous situation.
But they go for years and years with nothing.
Yeah.
And how do you pick it early?
Rarely they can get big enough that they act like a tumor and they start causing problems from pressing on some part of the brain. That's less common. Now, what I would say about that is anyone that has a headache that starts suddenly, especially with physical activity or straining.
Thunderclap headache?
Starts like a thunderclap, like a lightning bolt, worst headache ever, and sticks around for a few days. Should go be seen. Sometimes you can have these sentinel hemorrhages, which isn't, it's kind of a milder form of bleeding, but that increases the risk that in the next few weeks it's going to really blow.
Wow. And
so any headache that sticks around for a couple of days, that's unusual, starts suddenly, should be seen.
Great. What percentage of pre-cancer skin lesions are frozen off, and how successful is it? You have a comment about skin cancer?
Most of them are probably frozen off or treated. So it's pretty rare that they progress.
Right. I mean, I do it.
I'm sure you do it in the office. Yeah.
I mean, I bet 10% of what I do. I mean, I see these skin cancers on their face, or pre-cancers, and I'll use cryotherapy all the time. And I mean, you know, you can clean, after a while, you can clean off their face, and they have a decent-looking face again. And then there'll be one that just doesn't want to go away. If you freeze it a couple times, you better scrape it off or excise it.
Yep.
And some of those will spread.
Some of them do, yeah.
I think the data on scraping it off, freezing it off, excising it widely, it's like 3 to 5% will spread. Whatever you do, it's going to still can spread. 63-year-old Freeman was wondering about rheumatoid arthritis, fibromyalgia, amyloidosis would increase her risk of cancer because she has a decreased immune response. Do you think that, number one, I don't know that there's any data to say that these people...
There is actually. So they do have a higher incidence of mostly lymphoma. And it has to do with the regulation of the immune response. So it's kind of the misregulation, but it's not like dramatic. But with autoimmune, some of those autoimmune, it's
can increase your particularly your blood
type cancers. Yep.
Well, and then you start treating them with immuno agents.
Then that could be it too.
There you said it. What are the chances of prostate cancer after a needle biopsy spreading because of the needle biopsy? Hank, do you have any comments about that? You do needle biopsies all the time.
That's the other end of the body.
Yeah.
It had nothing to do with the prostate, he said. Why are you asking me this?
I've on purpose steered my career away from that area of the body. Yeah. So I am not the best person to answer that question.
But you do needle biopsies of cancers. Do you ever see cancer spread along the needle biopsies area?
No. With the brain cancers, you don't see that. That'd be unusual.
There you go. Comment on your top 5 things within your control to help prevent cancer.
Don't smoke.
Agreed 100%.
That's number one. That's number one.
Alcohol, if you drink it, do it in moderation. It does increase your risk, but it has to be quite a bit, which is good.
All right. My number 3, if we're talking head and neck cancers, I would say don't leave skin lesions alone. To grow, get in and be seen. Many of them can be treated with a little cryo or scraped off, and then you have less chance of it spreading.
The other thing is this whole tanning bed thing. I don't know what you think about it, but the data is very clear that it dramatically increases your risk of skin cancer. So, I mean, a little bit of tan probably in the summer we can tolerate, but boy, that's a huge UV load that they get every time. So
now, correct me if I'm wrong. My understanding of that is that melanoma actually is the least associated with UV exposure.
Correct.
But still, maybe is that the?
I think that's what it says. I think that's it. The highest risk is even the basal cells.
Yep.
But it's interesting. Basal cell cancer doesn't occur that much in the black people, and they have this, and their cancers occur on scars. So that was top 3. That's good enough, I think. Here's 2. What with the odds so high for ending up with cancer, is it just a crapshoot, depending partly on your genes and partly what you're exposed to? Statistics are rather alarming. What do you and your guests do for cancer prevention in your own lives?
The things we just discussed. And I will say part of the reason that we are seeing so many cancers is because of the progress that we've made in medicine over the last century, and people are living so much longer. So you have more time to
catch that cancer.
Yeah.
It's an older age disease. I mean, the longer you live, the higher risk you have of cancer.
Right.
I think to put a point in prevention is really important here, though, too. So, I mean, getting your colonoscopy, especially if you have a history of polyps. I mean, these are the things, if you can prevent it when it's more of a benign, doing your PAPs, and think what pap smear and stuff did for cervical cancer in the U.S. I mean, I think there's certain things, when Dr. Rick Holm recommends it for prevention, do it. Because those things, we wouldn't do it as a system if it wouldn't be beneficial. So
I also would say that the idea of getting the viral vaccine, the cervical viral, the human papilloma virus, for goodness sake, that is a lifesaver. I mean, and it may well be a head and neck cancer.
It could be down the road,
One thing that I'll add to that is, you mentioned colonoscopy, and really, there almost should be no colon cancer if everyone got a colonoscopy.
Only a third of us are doing it.
There's some recent stuff that's come out about people who do smoke or have smoked in the past that screening for lung cancer with CT scans on a certain interval.
Yeah, do you have a
help.
thought on that?
I don't know much about it because, again, it's not exactly in my area, but I just happened to see some of that recently, and it's just sort of caught the highlights of it.
But a CT scan is 100 chest X-rays. And
There's some radiation.
yeah,
that's right.
there is. And certainly people at high risk who have a family history of cancer and have been a smoker. But what do you do? You find a lesion on a CAT scan. I've done this more times than you can know. And you go, what do I do? Now am I going to biopsy that? That's a major risk thing. Well, let's just CT it again in 6 months.
Yeah.
Oh, well, it hasn't changed. Now, are we okay to wait another year? It just adds to the cost and the complexity of it. So I'm going to wait on this CT of the lung. That's a good question, though, or a good comment, and I'm not right there yet. I think, I'll say this, because I haven't said it yet, and I always say it on one part of the show, there's nothing that prevents illnesses more and better and more effectively and more enjoyable than a regular exercise program.
Yeah.
And it has been shown to prevent certain cancers, particularly colon. And so I'm going to throw that in.
And it's true. I mean, I think one of the epidemics we're seeing now is completely related to our obesity and lack of exercise. That's a really good point. And the data is very clear. Breast, colon, several of them are completely related to your obesity index.
Well, and your lifestyle, too.
Yep.
So along those lines, are U.S. citizens at statistically higher risk than most? Is that environment and lifestyle? And the answer is, I don't know the answer. I don't think we know the answer, but we do have a better cure rate, or at least the same cure rate.
Yeah, there actually is a little bit higher incidence for brain cancers in developed countries compared to developing countries, but
really,
that's a statistical anomaly, most likely. People in some of these countries, there's less detection, and in some of these places, people live a lot shorter life.
Yeah, there you go. So, my last question to each of you is, so what take-home message you want to make absolutely sure that we say tonight that needs to get out there?
You know, of the things that we've discussed, I think the preventative things, that's probably the most important. The not smoking, exercising, and getting a colonoscopy. If you do those three things, you're cutting your risk significantly of having some of these problems.
Wow.
I think those three things are, if there's just three things that you're going to do those three.
All right.
Yeah, I think two things. One is, especially for head and neck, if you have the symptoms we've talked about, go get seen. I mean, and sooner rather than later. And the second is, I think there's hope, and there's going to be better hope as we move in the future. And I think that's a key, is that you heard the two people tonight on the television, and I think both of them, they went through, it's a painful process, but for the most part, I think, like you said, it's nice to have a negative pet, so it's good to have them around longer.
Yes. Thank you both for joining us and answering these questions, and thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. And until next time, from all of us here at On Call, stay healthy out there, people.